Hello, and welcome to our panel on ransomware. My name is Jeanette Wider, and I'm the managing editor of Healthcare Innovation. Troy, why don't we begin by you introducing yourself, a little about your title, your role?
Thanks, Jeanette. It's a pleasure to be here. So Troy Ament with Fortinet. Joined Fortinet in the past year after a majority of my 20-plus year career in the healthcare space. Most of which implementing electronic medical records, doing digital transformation and virtual visit technology, and then pivoting over to kind of my core technical background, which is in cybersecurity as the CISO for two of the larger health systems here in the U.S.
Great. So as we all know, ransomware comes up in the news every day. We're hearing about it all the time. And over the past 12 months, healthcare and life sciences organizations had a significant increase in ransomware attacks. What's your perspective on these new and evolving threats that organizations are facing?
Yeah, so like anything, threats take time to evolve. And as they evolve in the beginning, they look very scary. But in some scenarios, it takes a while for those threats to realize their potential to impact an organization. And what we've seen in the landscape in healthcare is ransomware has been around for a few years now, but the adversaries have gotten, much more sophisticated. They're learning more about the organization. So they're learning more about, how to have more significant impact into these organizations. And to that end, they're having more success, and success breeds more adversarial groups that are targeting organizations. So not only are the threats getting more sophisticated and impacting organizations' operations more, but there's going to be more threat actors. They're leveraging more vulnerabilities within organizations, and these threats, as we've seen in organizations today, are impacting patient care more and more. I think just in the past few weeks, we've had a new press release with an organization that's had a lawsuit filed against them because they were under a ransomware attack, and someone had an adverse patient event to their baby, and there was a death. So organizations are going to have to continue to evolve in how they notify their patients, and giving patients potentially the opportunity to make a decision if they want to have care at those facilities during any type of adverse event, whether that's a ransomware attack or a facility disruption with power or water or otherwise.
Right. So obviously the impacts for clinical and operational are unprecedented. Let's talk about how organizations are being impacted and what they can do from a patient care, revenue, and brand impact standpoint.
Yeah, so I touched upon a little bit of the patient care and patient safety aspect of it, and that's probably the most important, right? I think that, as we've had digital transformation, and sometimes that's an overused term, but really what's happened, if you're a physician, if you're a nurse, if you're a pharmacist within these health systems, if you've transformed, right, over the past 10 years. No longer using paper charts. Is there paper processes within filing systems of hospitals? It's all connected. So if you're a patient, at having a clinic visit, that physician has the ability to search your records, and then after having a diagnosis within that event, ordering different laboratories, ordering different pharmaceutical goods for those patients, maybe ordering a CT scan, that type of thing, and they're all really automated. So what happens within that ecosystem when that breaks down, there isn't great backup procedures within a lot of health systems to move back to a paper system. And the reason that we did a lot of that transformation, kind of going back to 10, 15, 20 years, is to become more efficient. And when we move back to paper processes, the only logical result that can occur is organizations become less efficient. There's less patient safety stopgaps in that process to ensure a safe experience. And they're having to turn away maybe elective procedures, and ramp that down, which impacts revenue. So that's been some of the big impacts from a revenue perspective. We've seen organizations having to deter patients over to facilities that they're maybe competing with, maybe delay elective procedures or, those types of things. And then from a brand perspective, it causes pause, right? For patients, they're like, well, maybe I'm going to go to the competitor because they have not had a ransomware attack, and being a little bit nervous. Wow, if I'm in a facility and I'm having a baby and having a C-section or having a significant surgery, what could that mean to my patient experience and to the safety of of my own health?
Right. Right. So one thing I keep hearing from cybersecurity professionals such as yourself is that foundations and those basics are really key to a cybersecurity strategy at organizations. So can we talk a little bit about some safety practices like identity and access management, zero trust, IT governance, and how are these and maybe some other practices you could share with us important for healthcare organizations?
Yeah, I think that's holistically important, right? So as I talk with, and as we partner with a lot of health systems, we really seek to understand where they're at in their journey from a security perspective. There's a lot of scenarios where organizations don't have, that foundational security. When we look at ransomware attacks, when we look at phishing attacks, or loss of data breaches across healthcare, a lot of times those breaches occur because of those foundational practices aren't in place. And, a few of them that I would, really like to highlight are things like vulnerability management. From a ransomware perspective, many times, unless it's a 0-day, a system cannot be compromised unless there's a vulnerability, unless there's some type of vulnerability in that system, they're able to inject that ransomware into. So having strong vulnerability management and visibility into what patching needs to be done within an organization. Another one, though, is strong identity and access management controls. Once an organization or once an individual, whether they're a privileged user or an unprivileged user, loses their credentials, the threat actors gain some type of access to that system, whether that's access to their email box, which could include many protected health information records, or maybe that's taking that credential and then stepping that up through a targeted attack to get more sophisticated access within systems and the ability to establish a foothold within that organization and spread ransomware internally as well. So identity and access management, as well as things like multi-factor authentication. So, we're all used to this within our bank cards, but having holistic multi-factor authentication within an organization, not just across the email or just across remote access, but across patient portals, physician portals, is of the utmost importance as well.
Right, good. Do you want to talk a little bit about how IT governance and clinical business alignment are key?
Yeah, so organizations don't stop moving, right? So, I think in this past year, a lot of organizations, specifically in the provider and payer space, have had to really pivot, from a workforce mobilization. A lot of health systems, probably a high 90% of all their employees, of course, providers in a lot of, areas had to be on site, right? Doing that patient care where virtual visits weren't possible. But if you look at service center type activities, whether it's revenue cycle, accounting, information technology with all the privileged users there, that's really changed, right? So the adversaries know that. They know that a lot of organizations have moved their employees home. In some scenarios, they've done it very securely, right? They've adopted technologies like SD-WAN and multi-factor authentication so that they have visibility and secure connections to those locations. But in a lot of scenarios for organizations that weren't ready for that adoption, but had to anyways, they had to do it really, the best they could, right? So the adversaries know that maybe instead of 10% of employees working from home, maybe it's closer to 30 or 40%, including some physicians managing virtual visits. So the adversaries are going to pivot there, and they're going to look at that exposure, and they're going to, target that larger group. Maybe that's a phishing attack that an organization could protect against more easily through the visibility that they had in the office, that they've lost visibility with those users being home. But then also we've really pivoted and started doing much more virtual care. So at my former organizations, even though that we did big marketing campaigns and big enablement of physicians, we were still with 5,000 physicians only doing 70 to 100 virtual visits per month, which was a very small number. But post-pandemic, we're doing 35 to 45,000 virtual visits per month. So that means that there's all of these sessions going on and all of this patient data that's available on these virtual visit platforms that needs to be protected. But also to that end, when you look at a ransomware attack, a lot of times this cripples the entire operations of a facility, including virtual visits. So if you think about losing 3 to 4 to 6 weeks of virtual visit activity and the revenue tied to that activity, that's very crippling to an organization. It reinforces the need to protect, these newer mechanisms that organizations are adopting.
That's a huge increase in the number. So what that brings to mind for me is how is the C-suite reacting to this? Do you have any tips for our audience on perhaps some leaders who don't want to spend too much money?
Yeah, that's a great question. So what's interesting about it is a lot of IT organizations really respond to the demand, right? And sometimes they have to move very quickly to satisfy that demand. And in some scenarios, things like having great backup systems in place. Those are the things that sometimes gets skipped, right? Things like resilience and having DR sites and that type of thing. But then lastly, having security integrated into that as well. So I think educating executives, one thing that I've seen significant success is partnering a CEO up or COO up with another health system that's had a significant breach, whether it's a ransomware attack or a loss of patient data, and doing those tabletop exercises with executives that unfortunately have been in that bad situation, so that they can say, this is what really happened, and yes, we put a policy in place to say that we're not going to pay a ransom if it happens, but then when the chips were down and they needed to respond, they maybe changed their mind. So just being ready and having the experience of folks that have been in that situation in the room is of the utmost importance.
Great. That's a great answer. So that brings me to my next question. The cybersecurity talent gap has been something challenging for healthcare organizations. What are some strategies to overcome these challenges?
Yeah, so talent, both very experienced cybersecurity individuals and both recruiting new employees is an area that an organization has to really tackle. And I think the first area that I recommend leaders like myself is to partner with human resources and educate them, making sure that you've got really an employee lifecycle plan in place, so that as you're recruiting new individuals into your organization, that they have opportunity. Because I think the biggest thing that we see is these new employees, they want to have opportunity to grow within an organization, and I think that's very important. So making sure that you're competitive on salaries, making sure that you have a flexible ability for folks to work from home, but then also the ability for them to grow as a professional within their role technically as well. So training is very important. One area of success on the newer grad area that I've seen organizations do, and myself, is partnering with large universities that have comprehensive cybersecurity programs, getting out there twice a year and having your directors and VPs buying them pizza, telling them about what you're doing in your program. That'll get them to listen. That always gets them to listen if you're buying food. So, but on the other end of it as well, that I've seen success is establishing those relationships. So if they don't come to your organization, as they grow maybe 5 to 10 years within their career, they know who you are, and you've established and you've networked with those individuals as well.
Right. Do you have any thoughts on consulting partnerships?
Yeah, and something I didn't mention, so I'm glad you asked that. So we're seeing more and more health systems and really all verticals, right? Within life sciences and healthcare and outside, partner with managed security providers, organizations like Fortinet that have 10,000 plus cybersecurity professionals, helping organizations ensure their systems are safe. Really manage security operations center, manage endpoint solutions. That's an area that I think organizations can really leverage, both short term for maybe project-based efforts to improve some security posture and maturity within a program, but then also maybe long-term staff augmentation for doing security operations center work, maybe a second set of eyes for watching systems and having a different perspective as well.
Right. And finally, my final question in this sub-question, do you have any thoughts on security automation through AI or machine learning for these gaps in people?
Yeah, and you hit it right on the head there. Another area that I missed is really leveraging automation, right? So if you think about how a security operations center runs, there's some threat response that is very manual. So maybe an example of that is a playbook within a phishing attack, and maybe there's 10 things within that playbook that a team of analysts needs to do to respond to that. Well, many times as organizations grow the maturity of their security operations center, they can automate with the utilizations of things like SOAR technologies, so security orchestration and automation tools, as well as looking at bigger data and mining that data with machine learning and artificial intelligence to say, okay, this is a threat. We don't have to spend so much time doing threat hunting across that data. The systems can tell us, and then maybe execute in a safe manner an automated response to that. I think the area that I'm really proud of security operations centers that I've seen and the staff in those is they're not looking to do those monotonous steps within blocking a website, blocking an email address. What they're wanting to do is develop a playbook, and then right after they've got a successful playbook that's helping protect their organizations, turn that playbook into automation, because then they can move on and do threat hunting against maybe a ransomware type event or incident, and then turning that into automation, because the threat actors and the adversaries are getting to be larger in scope and more of them. So really manual work with smaller teams just doesn't work for the future.
Right, these are a great answer. So one of the final things that I want to ask you today are, what are some advanced security technologies that allow healthcare organizations to stay like one step ahead?
Yeah, and there's getting to be more and more out there, right? So the first one I'd probably mention is we've been doing sandboxing quite a bit. So a great use case for sandboxing is an email comes into an organization. What it does with that email is it opens it up in a safe cloud environment, and it opens the email and looks to see if that email and the links within that email are safe and they are responding the way they should. Now, an abnormal email, if someone opens it and it tries to open up a system process and tries to encrypt files, that's not normal. So the system can automatically know in the future to block that email and ensure an organization is safe. But what we're seeing is that is even more advanced, because sandboxes can take some time. So putting inline AI technology that is looking at the network stream and being able to make those same determinations within milliseconds to protect an organization is even more advanced. So we're seeing the adoption of things like 40 AI and that automation across a lot of organizations that want to be one step ahead. Another area, though, are things like deception tools that provide a different perspective of visibility. So an example of a deception tool would be two different things. The first one would be what we would call a fake connected medical device. And as we know in the healthcare sector, setting up a connected medical device is very manual. They connect and they process information from only a couple different IP addresses within our organization. However, if you set up a fake medical device and an adversary tries to compromise or access that medical device, you'll very quickly have some very high quality telemetry that to block or respond to that threat. Another example of that, though, is setting up maybe a fake patient access portal or a fake employee access portal. And you'll very quickly know if someone tries to access that and use valid credentials, that you need to have a playbook that blocks that malicious actor, but then also notifies that user that their credentials could be compromised and that their password has been reset. So you can be much more sophisticated and respond much quicker in those scenarios as well.
Right. That's really interesting. Do you have any final thoughts to share with us today about ransomware? Because it really seems like the bad guys just keep getting badder. Any tips for our audience before we conclude?
Yeah, no, I think one thing that I would just, continue to emphasize is, having organizations really assess their organization's, security program, ensuring first that they have, really a foundational security practice in place, and that they've got the gaps from, multi-factor authentication, vulnerability management, and then protecting users anywhere with any device that they're on. But then looking at some of the more sophisticated, technologies that are available, things like SIM and SOAR and AI-driven security as well, and growing that, and really utilizing and leveraging, industry standard maturity model matrices, things like the NIST standard as well.
Right. Okay. Well, thank you so much for being here today. It's been a pleasure talking with you.
Thank you, Jeanette.